Greetings. I have a great pleasure to present the paper Internet of Things for Precision Intensive Medicine in International Research Award on Infectious Diseases under the category of the Best Researcher Award. My name is Nasim Sadat Mosavi. I'm a PhD student in University of Minho, Portugal. Whereas precision medicine plays a critical role in revolutionizing clinical decision-making, accessibility and availability of patient data in a customized way empower this patient-centric practice. This paper aimed to highlight the significant role of IoT in emerging precision medicine applications. Although there has not been a unique definition for IoT yet, the term things-oriented has been used widely in literature to present IoT as an ecosystem where things and people are connected anywhere, anytime via network connections. Based on that, Internet of Medical Things include the connection of medical devices, medical sensors, and people and applications. The major functionality of IoT applications are continuous patient health monitoring, advising the patient regardless of geographical location, disease diagnosis, and using proper alarm system when it's required. Why precision medicine? Still, in the context of recently published literature, over 138,000 studies discussed medication errors. Over 450,000 includes delay in treatment. Still, the problem of people dying from medical care gone wrong has not been solved. From the general point of view, failure of symptom-based clinical decision-making, which resulted in poor quality of healthcare services, and also availability of healthcare big data and limited human cognition for timely decision-making. In addition to digital transformation under the influence of technological advancements such as IoT, artificial intelligence, and analytics, caused a shift from one-size-fits-all protocol to patients like me to release the right medicine with the right dose for the right person at the right time. U.S. National Library of Medicine defined precision medicine as an emerging approach for disease treatment and prevention that takes into the account individual variability in genes, environment, and lifestyle. Considering IoT to pioneer the adoption of precision medicine, these arrangements provide effective data that comes from various resources for health analytics in order to discover meaningful and actionable information that improves clinical decision-making. Also, personalizing healthcare services in a cost-effective and proactive way. In addition to advanced, accurate predictive approach and care-based health services, and accelerate precise treatment and care-based services. So, based on this approach, there are firms that facilitate adoption of PM by offering infrastructure and relevant IoT devices such as Amazon's Genomics in the cloud, Google Genomics, IBM Watson Health, and SAP Health. The architecture of IoT consists of specific layers. We categorize major layers in 4 groups: application layer, real-time data processing and storage layer, network connections and communication, and real-time data creation and data collection. The application layer is about clinical decision support system, smart home automation, health self-management, rehabilitation and wellness. In fact, the role of application layer in IoT enables precision medicine to propose high-quality services via user-friendly interface for the end users. The major functionality of the application layer is to provide continuous health monitoring, therapy, personal digital assistance, well-being, emotional well-being packages, emotional well-being, fitness programs, emergency responses, rehabilitation, and also elderly care, also to track patients' health and also to detect patients at risk. In terms of decision support system, those applications are important for decision maker to interpret the results and for clinical decision making. Hospital IoT medical systems such as RFID and wireless sensor networks, smart mobile applications, and wearable medical devices also are important to provide effective data. And mobile application facilitates communication between patients, nurses, and other hospital staff in order to collect critical information such as environmental and lifestyle variables from the patients. The next layer is about real-time data processing and storage. So the data processing layer performs via extraction, load, and transformation, or ELT. So the improving the accuracy and validity of health data are critical for analytics and algorithms to provide or to demonstrate the best possible outcome. Healthcare data comes from various resources with different format. Data is fragmented and unstructured. In fact, data comes from heterogeneous connected sensors such as variable that needs to be integrated with electronic health record. So the quality of data might face some limitations. For example, mistaken data entry, missing interpretation. Those mistakes might be as the consequence of clinical staff. So there are some solutions to deal with those mistakes and limitations, like using advanced technologies that influence the quality of data processing in data processing phase. In 2015, some firms provide a total solution in order to shift image processing from the computer-based to cloud-based. So using cloud platform is a solution to deal with some specific limitation in terms of data processing and data storage. Next layer is about network connections and communication. So the network layer is responsible for providing secure, reliable, and effective connection between things, people, devices, sensors, and applications. Therefore, adopting standards and affecting architecture and infrastructure systems impact the interoperability and security which are required for IoT to perform efficiently. This network needs to be expandable, compatible, and reliable, and secure for data collection. Some limitations influence the quality of communication, such as battery shortage or poor quality of wireless connectivity, being disconnected from the network or cloud that influence data collection or the quality of data, limitation associated with data collection by variable, for example, like a football players that cannot use variables continuously. Next layer is about data collection, data creation and data collection. This layer includes specific sensors which perform via specific devices such as home automation, wearables, specific sensors, smartphones. So there are some specific sensors like biological sensors, using temperature, heart rate as a biological indicator, which are important for adopting precision medicine. There is an example of health self-management, as you can see. For example, to monitor patients with diabetes. For example, sensors to control the glucose, mobile application for educating patient, a wearable device for tracking physical activities, motion sensors to identify psychological behavior, daily tracking for insulin, meals, exercise, and sleep, predict and create personalized alarm if it's required, Bluetooth device for cheaper data transmission, and digital games in the line of social and educational platform. In conclusion, this paper demonstrated the role of IoT in adopting precision medicine application. The interconnecting architecture of people, sensors, devices, and application under a particular protocol creates accessibility of customized data for individual patient and facilitates the adoption of precision medicine to improve the clinical decision making. This arrangement potentially improves the quality of treatment by cutting an extra cost associated with inaccurate and unnecessary diagnostics, medications, and care plans. Also, reduce medical errors and design preventive care for patients with similarities. This approach is under the category of precision medicine. So this practice improves intensive care medicine, which is characterized by considering the heterogeneous data and in general moving from one-size-fits-all approach to patient-centric care or patient-like-me approach, which is enabled by IoT. Thank you very much for this opportunity.